Did you know that the first quarter 2022 coding clinic has been released? And there is some information that is helpful for you if you are in the behavioral health space. So check out this video for details. Hey there, and welcome. If you are new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've served hundreds of students and helped them transform to become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. So hopefully by now, you all know that the first quarter coding clinic had been released. And there was a couple of things that I saw that piqued my curiosity. And I was like, oh, especially for my wonderful behavioral health folks. You know, I always have a passion for them since I've had several behavioral health clients. One of them in the question and answer session, one of them is around diagnosis coding for an inpatient condition. And the other one is pretty much, I think, just general knowledge regarding combination codes. So I'll ask the question and then provide the answer that the coding clinic gave. The first one is a patient was admitted for treatment of a malleus fracture of the right ankle. The provider documented alcohol abuse / monitor for withdrawal symptoms. And that's in quotes, so that was a direct documentation information. The patient also had a history of anxiety and was prescribed Cymbalta during hospitalization. Based on the with convention, IA.15, should we assume a link between anxiety and alcohol abuse and assign code F10.180, alcohol abuse with alcohol-induced anxiety disorder? And the answer says, do not assume a relationship between alcohol abuse and or dependence and anxiety. Although the alphabetic index links alcohol with anxiety disorder and alcohol-induced anxiety disorder is part of the code narrative, an alcohol-induced anxiety disorder is not the same as having anxiety and alcohol use, abuse, and dependence. Further, the tabular narrative for codes in subcategory F10.18, alcohol abuse with other alcohol-induced disorders, indicates these codes are assigned for alcohol-induced disorders, and such a relationship must be documented by the provider. While chronic alcohol dependence, abuse, or use may lead to an alcohol-induced anxiety disorder, there can be other underlying causes of anxiety. So these conditions should not be linked, again, unless the provider clearly documents a relationship. And then the second question kind of falls in lines with that and just adds, I guess, more clarity. It says, should combination codes be assigned from categories F10 through F19 mental and behavioral disorders due to psychoactive substance abuse or substance use anytime a patient with a substance abuse or dependence diagnosis also has documented anxiety, mood disorder, sleep disorder, or sexual dysfunction based on the with guideline. And if you are working in the behavioral health space, you know that they always have these additional diagnoses documented for the patients. At least it has been my experience. There's a laundry list of diagnoses that you will run across, in addition to the substance abuse, use, or dependence. So the answer is, do not assume a relationship between substance abuse and or dependence and anxiety, mood disorder, sleep disorder, or sexual dysfunction. Although these conditions are terms that are located under with in the index, the narrative in the tabular indicates these codes are reported when the condition is documented as an alcohol-induced disorder, and such a relationship is documented by the provider. So the key to all of this is there needs to be some documentation to support all of that by the provider. That is the key. And we can't just, I know we have our guidelines and we have things to help us make sure that we're coding accurately. But again, our accurate coding is based on the documentation and based on what the provider has documented about that patient. So that is what I wanted to come with you today for our kind of news segment or information coding segment.
Getting back to like the first scenario, I would have coded it with anxiety, because it would have, so that's, you can link it with the, when it says with. So I'm glad that's a coding clinic, because that's why I'm like, it all comes back to documentation. So in order for it to have been coded with, according to the way it was coded, the provider would have had to have said alcohol-induced anxiety.
Correct. Correct.
So, okay.
Because they could have had anxiety due to other reasons, not necessarily. And especially since that patient, right, and the patient came in for a fracture. Right. Yeah. So who knows all the circumstances or situations related to that. So it may or may not necessarily have been just due to the alcohol. So unless they clearly document that and link that. So you have learned that there are several clarifying instructions to behavioral health ICD-10 codes that you need to know that have been published in the first quarter 2022 coding clinic. Questions of the day. Did you know about this information? Have you followed and seen the newest coding clinic? There are a lot of actual information there. So if you get an opportunity to check it out, I encourage you to do so. My final thoughts, as I've always said, make sure you have the appropriate tools in your coding toolbox to help you become a certified marketable medical coder. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. And if you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos and check this out. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. If you like the video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know you were here by asking a question, providing a comment, or just stopping by to say hi. You could also give me a little love by sharing this video on your social media platforms. Tag me in your video share at PRN Coding EDU. Let's stay connected and connect others. Well, you have stayed until the end. Let me know in the comments where you are checking in from. If you want to learn more about the wonderful world of health information, medical coding, and or compliance, then watch one of these videos. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and thanks so much for watching.